Welcome everyone to today's webinar, Achieving Sustainable Revenue Growth, How Providers Can Compete with the Winning Access Strategy. I am Christelle Kazaka with Becker's Hospital Review. Before we begin, I'm going to walk through a few quick housekeeping instructions. We'll begin today's webinar with a presentation, and we'll have time at the end of the hour for a question and answer session. If you have any questions throughout today's webinar, you can type those into the Q&A box you see on your screen. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. Lastly, if at any time you have trouble with the audio or video, please try refreshing your browser. You can also submit any technical questions into the Q&A box, and we are happy to help. It is my pleasure to turn the floor over to Bree and Sarah to begin today's presentation.
Thanks, everyone. We're so glad you could join us for today's webinar, Achieving Sustainable Revenue Growth, How Providers Can Compete with a Winning Access Strategy. My name is Sarah Rosen, and I head up product marketing here at Notable. It's great to be with you today. And what that means is I spend a lot of my time thinking about the market, listening to healthcare executives and trying to make sense of what it all means in terms of the future of intelligent automation. And I am joined today by my colleague, Bree Buck. Bree, would you mind introducing yourself?
Sure, thanks, Sarah. Hi, my name is Bree, and I lead our patient access solutions here at Notable. This means that I spend my days talking with healthcare systems and providers to help understand the benefits for automation for healthcare organizations.
Great. Well, thanks, Bree. Let's go ahead and dive into the agenda. So before I do that, I'd love to just share a few thoughts. So as I've been thinking about the market since the start of the year, a lot has changed. So we started the year thinking about a rebound from Omicron, bullish about this post-COVID recovery. Now, fast forward a few months, and something has palpably changed. Of course, we're focused on operational efficiencies and combating labor shortages. And as an intelligent automation partner, many executives ask us here at Notable about how intelligent automation can help with these issues. But there is a growing realization that a focus on cost cutting and operational efficiency alone will not get us out of the woods. Growth is needed. Now, what that growth looks like in a post-COVID world is different. And we believe that growth can be powered by intelligent automation. And so that is really the premise and what Bree and I will walk you through today. So looking at our agenda for the day, part one is today's growth imperative. So I think we are all acutely aware that that earlier optimism that I talked about improving operating margins has given way to a really different reality. Labor and supply costs combined with lower volumes now face us. And on top of that, there is a probable economic downturn, and we're already starting to feel it. But we know we can't cut our way back to stronger margins. Growing the top line is hard, but necessary. So I'm going to describe that landscape. And then I will then hand things over to my colleague, Bree, who's going to talk about what can be done to address these challenges using intelligent automation to power access and the revenue cycle more broadly in service of growth. So let's go ahead and dive in. So on this slide here, wanted to just share some data to level set. So as the economic situation has worsened over the past few months, many providers we've been speaking with are rethinking their strategies. Now they're still up against the escalating expenses that you see here, drugs, supplies, and especially labor in a time of shortages. In response, the vast majority of chief financial officers are actually planning to decrease operating budgets, especially in the area of travel nursing, corporate overhead, supplies, and EHR upgrades, just to name a few. But the same executives are realizing that this focus on cost must be balanced with the growth imperative. A quote I saw from a chief operating officer of a large health system summed this up really well. And she said, "The board is asking what's the right balance between hunkering down and getting through this versus putting the hammer down and going as fast as we can on growth ideas." This is critical amidst the pressure from ever-rising consumer expectations and disruptive competitors. So let's first talk about those consumer expectations on the next slide. Margin pressure or no margin pressure, patients now expect digital-first interactions with providers. On the left, you can see more than half of patients want to use technology to communicate with providers and manage their conditions. And this is just the beginning. If you look at the chart on the right, it depicts 3 technologies. So we have online scheduling, electronic messaging, and video consults. So in the graph, we see the COVID bump, as I like to call it, followed by a COVID dip or post-COVID dip. But leading experts anticipate future widespread adoption. So we're just getting started here. COVID was merely an acceleration of this shift to digital patient engagement, but both expectations and adoption will continue to increase. And both traditional and non-traditional competitors are trying to capitalize on this. Digital has no doubt had the potential to become a competitive advantage. The realization of this is another story, but in fact, this has been a critical part of the deal thesis or the investment thesis for M&A activity in the provider space. The continued consolidation of hospitals and health systems has had the potential to repair fragmented and piecemeal approaches to digital technology investments. The idea is by coming together, health systems have sought to realize the promise of operating at scale to attract and retain patients across any channel. And this is not slowing down. Some data I actually just saw this morning, healthcare merger and acquisition revenue hit a record high in Q2 of 2022, with 13 transactions generating $19.2 billion. Now, looking to the right of the slide, at the same time, we've got the non-traditional competitors, and they've been using digital to disrupt or at least attempt to disrupt for some time. Some of these competitors, like Amazon, obviously have deep digital competency, while others like UHG are pursuing partnerships to acquire it. What's so worrisome about all of this in the conversations that I have with hospital and health system executives is that all of these players are vying for the same patients and have the potential to control downstream referrals. But most executives do not think that their current patient access strategy is doing enough to capture and maintain share. As you can see from the data here, the majority of executives still report they are underperforming on patient access. Almost 70% of leaders surveyed gave their system a grade of C or lower. Despite investments and COVID-driven progress, there are a wide variety of bottlenecks that prevent patients from digitally engaging with providers, from scheduling appointments to actually preparing for their appointment to following up. But this is not for a lack of investment. Patient access has been high on the priority list for many years, perhaps even the highest I've seen it amidst COVID. So what is the reason for the shortfall? In the race to meet the new requirements of contactless and virtual care, many health systems adopted a wide range of solutions, or of course tried to leverage the EHR to do many of these things. And on the surface, many of them have achieved their objectives. So patients can register digitally. They can get a text message about an upcoming appointment. They can interact with chatbots instead of calling the call center. But we see that these investments present 3 primary pitfalls. First, these solutions have created more work for staff, not less. Second, they have relied on the patient to drive forward their own care at every step. And finally, while legacy technology investments may advance goals in certain areas of the organization, they fail to advance the organization as a whole. So I'm going to go ahead and double click on each of these pitfalls. So first, as you can see on this slide, providers have invested in a broad array of digital solutions with the hope of improving patient access. But in reality, as I just mentioned, these solutions simply create more work for staff. Scheduling solutions often send requests to work queues for staff to manage. Two-way texting literally means that someone at your front desk or the call center are on the hook for individually responding to incoming text messages, in addition to everything else that they need to do and multiple screens to manage. And what we find is that neither the nature nor the volume of additional work for staff is known beyond that pocket of the organization. But the front desk, the call center, the clinical staff, they know it all too well. And this is largely a result of legacy technology that prevents other solutions from being able to read and write into every discrete field in the EHR, and that prevents them from getting that high fidelity information from patients at the get-go. The consequence is just unabating manual work. And this is going to prevent staff from finishing the work that they have on their plate in a timely fashion. And that means that your organizations have to staff up to compensate, which is not even a possibility given the labor market for many providers at the moment. So moving to our next pitfall, most solutions on the market are simply not sticky enough or intelligent enough to keep patients on track in their care journey at every step. They are reliant on patients to initiate their care, whether it's at the outset of that journey or after a specific appointment. So on this slide, you can see a typical patient journey. This is a patient who needs a mammogram, and we're going to learn more about a similar patient's journey later when Bree walks us through that part of the presentation. But she needs a mammogram, and that obviously has a cascade of other care that she needs to as a result. And at each step, this patient must initiate her own care, usually by phone, in a very stressful time. And what this means is that at any moment, she could leak out of the system. She could choose care from another provider who just makes things a little bit easier. And the third pitfall is on this slide here. And this is about the fact that each constituency across your organization, medical group, the revenue cycle, digital or innovation, IT leadership, they're all trying to solve the problem of remaining competitive and growing and getting paid appropriately for care. However, each of these entities experiences these challenges differently and prioritizes slightly different measures of success. But legacy solutions typically only serve one constituency at a time, and actually it's worse. It may serve one constituency at the detriment of another. So just to give an example, a registration process may be really great at eliminating errors, but can require front desk or call center staff to confirm eligibility several times throughout the process, requiring cumbersome phone calls and back and forth. The result is that KPIs in one realm may look great, but overall performance and experience at the organization may suffer. So how can intelligent automation address these pitfalls that are produced by other types of technology? Well, Notable is built on a platform, so that means a few things. First, we can holistically address patient access through all of the solutions that you see on the first line here, from Pop Health to referrals to authorizations to scheduling to intake. And across these 5 domains, we're automating over 50 different workflows, ranging from payment collection and registration all the way to care gap outreach, to referral scheduling and prior authorization submission, and many more. This approach means we facilitate both attracting patients and ensuring they are able to continue their entire journey with the provider. Second, the layers of engagement, intelligence, configuration, and integration ensure that we are collecting high fidelity information from patients upfront that can be written back into discrete fields of the EHR. These are the building blocks you need in a platform to be able to automate the 5 solutions that are shown up top. And at the end of the day, we are enabling digital assistants to do work on behalf of your staff, allowing your staff to focus on higher complexity, more meaningful work. When done well, intelligent automation can uniquely power sustainable growth. So what does that actually mean? So the top line here is that intelligent automation can be your engine for acquiring new patients and retaining existing ones without large capital investments, such as acquiring other physician practices, other providers, brick and mortar investments. All this can be done actually through digitization and automation. So how do we do this? So first, we can hardwire every step of the care journey to prevent leakage. So actually keeping that patient in the system after they have received care. Next, we can help collect appropriate reimbursement while keeping that cost to collect low. Third, we can bring new patients into the organization by allowing you to actually compete on experience and eliminate patient hassles, just making it easier for patients to get the care that they need. And finally, we can help you retain physicians by automating as much low-value work as possible for them, and of course, their staff. So with that preamble, I'm going to turn it over to my colleague, Bree, who will hopefully make this real for you and show you how intelligent automation can play a role at every step of a patient journey with the ultimate ambition of powering your organization's growth strategy.
Great. Thank you so much, Sarah. As Sarah mentioned, I'm now going to take you through a demonstration of what it looks like to have intelligent automation power an organization. We're going to do this sort of in 2 ways. We're going to take a look at what are the common challenges facing our 3 constituent groups, patients, staff, and providers, and then walk through an individual patient's journey to show where intelligent automation can have outsized impacts on the patient workflow, the staff workflow, and on the providers. So with that, I'd like to introduce you to our organization and to our patient. I'm going to take you through a blinded example from Pacific Coast Health System. And PCHS is a 4-hospital health system in the West where patient access is a strategic growth priority. And this is similar to a lot of organizations that Sarah and I talk to week. Typical investments kind of prior to intelligent automation include things like a custom digital front door app, some online scheduling, maybe some patient texting, a symptom checker, and then various front-end rev cycle automations. However, there's still several issues that are coming through in both staff and patient feedback. And that's excessive wait times for the call center, where about 70% of the calls coming in have to do with scheduling, confirming, or canceling. Still low utilization of these digital patient-facing tools, things like portals, things like the online website, self-serve activities. And then some, patients going to competitors when the wait lists or wait lines are too long. I also want to introduce you to a patient that we're going to use. We're going to follow her along her journey today through PCHS, and that's Catherine Smith. Catherine Smith is a patient who has been seen before. There's some information in the system of record, but we know that Catherine, has ongoing care needs, and we're going to take a look at what that looks like at PCHS. So the first thing that we'll see is Catherine looking to schedule her care. And even before we do that, I'm going to talk a little bit about the types of problems that we typically hear and that PCHS typically heard prior to rolling out intelligent automation. And we're going to look at this through the lens of our 3 groups. And I'll mention, as Sarah mentioned, that we're not just looking at the patient experience here. We also want to understand how these different systems affect staff and providers, knowing that they are core and crucial constituencies to supporting that growth. So what we typically hear in scheduling for patients is a dependence on a call center or calling in to get an appointment. Staff, needing to toggle between multiple systems or unable to keep up with call volumes. And then providers, being very distrustful of digital tools because they aren't sure if they can handle the complexity of a provider's schedule day to day. So we'll take a look now at the next slide. And, to underscore that point, we know that typical scheduling solutions that PCHS and other organizations have rolled out have not, achieved the ROI desired. And that's because patients like Catherine still need to initiate the care. The staff still have, long time-consuming workflows for each patient. And the providers still, are craving this flexibility before they're willing to open their schedules. So we'll take a look now at the next slide and see what this looks like when Catherine is proactively nudged to receive her care. Now, this is one of the ways intelligent automation can, have an outsized impact by reducing the staff burden and also increasing patient loyalty and patient keepage. And this is by, finding care gaps or clinical orders or referrals that have not been filled or are sitting in a work queue, and then actually reaching out to the patient digitally to allow them to self-serve complete that care. So we'll double click into this to see what it looks like for Catherine. If we open up the phone and show it on the screen, you can see Catherine receiving this text message. And what's happening here is Catherine is receiving a message to her phone from PCHS saying that she's overdue for some type of care, in this case, mammogram. And she'll receive a unique web link, which will allow her to schedule. As Catherine goes on through the experience, she clicks and is taken to a web portal where she can enter her date of birth and last name. Upon doing that, Catherine is asked some guiding questions that will triage her to the correct appointment, thereby ensuring that the provider is going to have a good experience when Catherine shows up and that Catherine will be there for the right type of appointment. Based on the answers to these questions, Catherine will then see the available slots for the right type of mammogram and the right location. And she'll also be able to look at different dates that work best for her, different time preferences, add an insurance card and verify that the insurance information on file is correct, add a secondary insurance card if that is part of her care, including the ability to take a picture, both front and back, and upload that card, verify eligibility, and make sure that this is the appropriate care for her. So all of this is, a minute, 2 minutes for Catherine, and the health system, PCHS, is reaching out to her to complete this workflow. All of this is, contributing to reduced patient leakage and also to an improved patient experience. Next, we'll see an example of a different patient coming in through inbound scheduling, capturing patient demand for care. And this is an example if another patient would need scheduling, but not be known by the health system prior. If we go ahead and double click on the demonstration, this will show an example of another patient going through the system. And in the example here, our patient can enter either symptom, specialty, provider, and then receive a series of triaging questions very similar to the ones Catherine got for her mammogram, which will help guide the patient to the correct appointment. All of this done in multiple languages in the patient's native language as necessary. The patient will first receive different routing questions that say, should you seek urgent or emergent care? And then any prerequisites to that care as well. And say if there's prior documentation or lab work needed. And then the patient is also able to check insurance, much as we just saw Catherine do in the previous vignette. And then we're able to see, is this a patient that's known by the health system? And once the patient is identified, bring forward that insurance information that we had previously. And you can see, again, the patient is able to, whether from the phone or from the desktop, add that insurance card, have that card read via OCR or optical character recognition, verify that eligibility, and then continue on to see different appointments that are appropriate for that patient based on insurance and clinical triage. All of this is another way that we can capture patient demand, whether it's patients who have been coming to PCHS for years and years, or whether it's new patients in the market who we'd like to bring into the system. Combining the outbound and inbound scheduling allows us to provide self-serve options for patients and create a better consumer experience across the entire continuum of care. This also creates a better experience for staff and providers who typically, must work through work queues and have, potentially frustrating manual work that accompanies booking a patient for care. All of this using the EHR as the single source of truth. I'll have you go forward. So again, talking about how intelligent automation can power the initial bit of a patient seeking care is providing that consumer grade patient experience, eliminating work queues and manual back-end staff, and then creating and facilitating trust to improve and increase provider adoption. And then if we go one more, we'll be able to see an example of this in action. An example is North Kansas City, who partnered with Notable to create intelligent scheduling and was able to drive a 2 times increase in new patient appointments. This led to an outsized impact, including a 96% patient satisfaction rate and 93% of appointments being able to be scheduled without staff intervention. Now we'll head on to the next slide, which will show our next portion, preparing for care. At this point, our patient, Catherine, and PCHS patients are in the system. They have an appointment, but we know that there is a lot of frustration and friction with the patient experience when they're coming in to seek care. And oftentimes redundant questions and data entry are causing a massive burden. This is frustrating patients because they're being asked to fill out the same questions. I know I've done this as well. Staff are tired of working backlogs of queues with missing pre-reg items, work lists or work queues, and then needing to enter that data into the EHR. And then providers are stuck with a high administrative burden, often needing to do some of this information because it was not taken care of upstream. And this is limiting provider capacity to do higher value tasks. So as we move forward, there's many intake solutions, many digital options, but many of them continue to underdeliver on the ROI expected. And that's because there's often a large volume of data entry that leads to inaccurate information up front, right? And we know that 1/4 of all denials are registration and eligibility related. So massive impacts downstream as well. staff have a heavy dependence on manual workflows. And then again, these providers have decreased capacity because they are doing many of these tasks that would typically be taken care of upstream. So let's take a look at what this looks like with intelligent automation. The way that automation and Notable envisions the intake process working is where we use technology to first find that patient in the EHR, to then prepare a personalized digital intake, and then send that digital intake to the patient. So let's take a look at what that looks like. You'll see here the process where we're actually removing barriers to care and removing that friction in the experience. Several days in advance, the patient will receive an appointment reminder that's inherently linked to their intake or registration tasks. The patient will have a unique web link, which they'll click on and then enter into a digital portal, which will have the tasks specifically related to their care. So you can see in this example, Catherine, because she has not been in for a while, has several different tasks that we would like her to fill out prior to her visit. Let's see what that looks like. And you'll notice within this, several of the fields are already filled out. And this is a core part of using intelligent automation to power intake, where if there's information that we already have in the system, instead of asking the patient for that information again, we'll just show that information to the patient and say, is this information still correct? If not, the patient can change it. But if it is, it allows the patient to continue on. This is an extremely high, leads to extremely high patient satisfaction, especially for groups like rehab and therapies, where patients are often coming back 1 time a week, 2 times a week, and prefer not to fill out the same information, which typically is not changing week to week. Now, this is another key component. As we know, all of this information is both pulled from the system of record, and then any changes are being put back into the system of record, much as a human user would at the front desk. And as we continue on, you can see that this information is coming from both the patient's record as well as the patient's chart. So we can pull key clinical information through our intelligent clinical intakes, or ICIs, where we'll pull information that a provider would typically ask during the visit and then repopulate that back into the patient's chart. The provider has it, and instead of needing to take those notes in the visit, is able to simply focus on the patient. In addition, we're also asking the patient for images as well. So for driver's license, for insurance card, which are then being uploaded to the documents table or media manager within the system. All of this leading to less scanning at the front desk, fewer paper forms, and less time overall needing to complete pre-visit tasks before going back and receiving care. You can see that Catherine is also able to pay her copay and prepayment as well, using Google Pay, Apple Pay, and any saved card information, making this as easy as ordering a package on Amazon or ordering an Uber. And you can see that, that Catherine is also able to access any consent forms, pull them up, and then e-sign as well. All of these tasks receive patient feedback like, wow, this is so helpful to be able to do this prior to coming into the office. The patient then has all of the information they need on a card within their phone or calendar, very similar to an experience when you're taking a flight as well. So let's continue on. Now we saw what this looks like for Catherine, but what does it look like for the staff? So the staff now no longer has Catherine's account in their missing pre-reg items work queue. They no longer have to enter this information when Catherine comes to the desk. And in general, the account takes much less manual work from the start of Catherine's visit to the end of the visit to when the claim goes out. Let's continue on. Now again, this is an example and hopefully makes it come to life what it looks like with intelligent automation versus a manual process. There's some things that make this experience really quite different, allowing for a better patient experience, staff experience, and provider experience. And that's creating that known and remembered experience for the patient, eliminating that back-end work for staff, and then creating high fidelity data from the get-go, which then reduces errors and denials downstream. And if we go to the next slide, you'll see an example of this intelligent automation with one of our partners, where after introducing intelligent intake, we were able to decrease or increase touchless registrations by 78%, or in total have 78%, with a patient satisfaction rating of 94%. Now, let's go to the next slide and we'll see the final portion of care, where our patient Catherine is now seeking follow-up care. And the hope here is that you can see when intelligent automation is powering the end-to-end continuum, what a different experience it is for all of our constituency groups. Now again, let's take a look at the problems we typically hear in authorizations and referral solutions. What we know is that patients often feel like there's a lack of transparency. So for instance, with Catherine, after her mammogram, her provider suggested that she go and get a breast biopsy. Now, oftentimes when that referral is placed, Catherine will have no sense of when she's able to actually schedule that appointment, what steps are needed, where her prior auth is. And that's typically frustrating for a patient who then is calling multiple times to figure out, can I schedule this visit, or who can I actually see for this? Staff often have, long work queues, a lot of manual work to actually process these referrals and authorizations. And then providers are similarly in the dark and frustrated to patients, unsure, due to lack of coordination. And this often creates barriers as well to providing timely care. So let's take a look at where automation can make a difference. First, one of the ways that intelligent automation will help is to power quick approval submission. Now, what does this mean? This means that instead of a human user or staff user needing to go through and review authorization requirements, automation can be deployed to do the first leg of the work. Secondly, the automation can also look to status portals, so to see any status changes, which will help drive authorization completion. And third, automation can be deployed to uncover root causes of unsuccessful authorizations. So why or why not something was approved can then be brought forward into the process for future patients and for future care for that specific patient. Next, intelligent automation can be deployed to help free up staff who are often bogged down in account after account in work queues. And one of the main ways that this can help is through work queue cleanup and statusing, which will increase staff productivity. Digital assistants can be deployed to ensure that eligibility is complete and determine whether or not accounts require prior authorizations. And in this instance, the digital assistants can look at Catherine's account and say, see that it is auto-approved, mark it as such, and have it drop off the work queue. And lastly, if there's a quick approval submission needed, the digital assistants can execute these submissions for that auto authorization. So let's look at the flip side for the patient experience. That is, how we can deploy automation to help in the back end. But for the patient, we still have this thorny problem of not knowing where the referral or the order sits, or when a patient is actually able to schedule. So Notable deploys intelligent automation to read all the relevant information from referrals, review all active referrals, and then send notifications to patients of their current status, and then prompt patients as soon as they're able to schedule those referrals, all the while creating transparency into the process and improving the patient experience. So let's see what that looks like. We'll show an example here of a patient who has had a referral placed, right? So Catherine has had her referral placed and now is receiving again another proactive outreach to go ahead and schedule that appointment. Catherine will receive another text message, another URL link unique to her, have the ability to enter in her date of birth and last name. And then we'll pause here and I'll show you the example of information given to the patient to increase transparency in the process. So Catherine can see her referral has been placed, her insurance has been approved, and now she's able to go ahead and schedule that appointment and see that her appointment is ready for scheduling. When Catherine clicks schedule appointment now, she'll have the ability to schedule any date and time that works for her, which is available on the schedule. And you can see here, very similar to where we started with the mammogram, Catherine's able to choose that appointment which works best for her and receive the information about her care. Great. Now let's talk a little bit about how referrals and authorizations are different when they're powered by automation. One, we can improve authorization throughput, which often creates roadblocks to patients getting care, frustration for staff and providers alike. We can also have patients become an active participant in their care by bringing transparency to the process and proactively prompting patients to schedule care. We can also use root cause analytics to prevent denials upstream and continually take information from what information we're getting back after authorization submission and bringing that forward in the process so that authorizations are smoother from the get-go. And if we go to the next slide, we'll see an example of a partner, Fort Healthcare, that worked together with Notable to automate their prior authorizations. They had a 91% successful prior authorization rate and saved 24 minutes per MA per patient visit. Now, all of this leads to a better experience, again, for patients, for staff, and for providers. Now, to review what we just saw, we saw our patient, Catherine, go through the PCHS system. We saw her first seek care through an outbound outreach that nudged her to go and get care that she was overdue for. We saw the preparation for the visit, reducing a lot of the staff friction and allowing Catherine to do the paperwork before she got to the office. And then we saw the follow-up experience where Catherine is able to have transparency into a referral, the staff work and manual work that's required to process that referral is reduced, and Catherine is able to get care much sooner. All of this shows the benefits that Sarah talked about in the beginning that can come from using intelligent automation to help power health systems growth. And I want to end with a quote from a chief marketing officer that has stuck with me, and that's, we need a front door, but we need some side doors too. Not every consumer goes into the main entrance, and we have to be able to solve for that. And I hope that between our discussion of macro trends, as well as showing a demonstration of intelligent automation, we've made those possibilities real for you today. And with that, I'd like to say thank you. Sarah and I are so thankful you've joined us, and we'll now open it up for a question and answer session.
All right, well, we are excited to take some questions and answers. Look, a couple of questions have come through the line, so why don't we go ahead, Bree, and kind of take those in turn. I'll tee up the first one for you, which there are a couple of questions that were essentially around which EHRs you integrate with, and then a related question around how we relate or don't relate to portals. Yeah, thanks, Sarah. Agree. Thank you for the questions. And in terms of integration, Notable is EHR agnostic, meaning we're able to integrate kind of across different EHRs because of our flexible integration methods and our implementation and deployment style. Even within that, right, we're across Cerner, we're across Epic, and different flavors of those with different organizations. I think with a lot of our organizations, there's use of both Notable and a portal side by side. Sarah, is there anything you would add there?
Yeah, I mean, I would also say that, particularly as it relates to our intelligent intake solution, the reason that customers seek out Notable and want their patients to interact with something that is, different from the portal is that most portal activation rates and utilization rates remain low. And so knowing that, ensuring that a patient completes the intake from start to finish and the implications that has from a patient experience standpoint, from a clinical standpoint, and then of course a revenue cycle standpoint means that organizations are frankly interested in an alternative. So you can think of Notable as an intake experience that is used oftentimes in place of that payer portal experience. Certainly not the components where patients would be interacting with their own healthcare data and health records, but the steps from pre-registration, registration, that uploading of the insurance card, the matching that we do on the back end to ensure that we're selecting the right plan, and that ultimately all the information that is gathered in the intake process is written into discrete fields into the EHR. And this is not only because that's a better experience for patients, but it's a better experience for staff because it's actually eliminating all of that back end work that frequently happens with other intake solutions where there's still a lot of manual working of a work queue or work list, or sometimes transcription of things from PDF into the EHR.
Yep. And Sarah, that reminds me, I know in studies we've looked at the overwhelming use of a portal for patients that have one. Majority is things like test results and provider communication. So often the data is showing, right, there's a need for something outside of that portal. And to your point, that's often where the intelligent intake solution fits in.
Great. Just scanning through the questions and definitely invite more questions from the group. Question around essentially how we're engaging consumers in the scheduling process. How are we actually marketing to them and getting them into the health system? And I'll start this one, Bree, and then turn it over to you. So, with our intelligent scheduling solution, we are powering scheduling that is on health system's website through the provider profile. But the part where, we're seeing a lot of interest from both current customers and prospective customers is actually outbound scheduling. So, there's a lot of care lost, not necessarily to the patients who never come to you in the first place, but the patients who come to you for a particular encounter and then have follow-up care that's needed, whether that is a return to clinic order or whether those are labs that are needed. And so through our scheduling solution, we're able to outreach to those patients through a text message, an email, and enable them to self-schedule that appointment. So, the focus really tends to be on retention and ensuring that we are not needlessly losing patients to, access points along the way, because when they need that next step in their care, they've got to call the call center. And, I think we all know the things that can go wrong when they're not able to easily get that next step scheduled.
Yeah, that's a great point. And I think maybe a secondary point to that is, oftentimes we'll see really robust marketing efforts to get patients to the website or to provider profiles. But then often when a patient is, looking through and has selected the correct provider, there's no ability to actually schedule that visit. And that, can often cause more frustration than other alternatives. And so in that case, we're trying to solve for where the patient has, already come to the page and is actually able to take action on that appointment request.
All right, we've got another question, Bree, essentially around our scope of authorizations and, which procedures can we cover, and, specifically some questions around oncology. And, I'm really, I guess my initial thoughts are around, prior authorization is an area where we are partnering really closely with each particular organization to understand where is your current volume, what procedures have the disproportionate share of auth, as well as which are the payers. And we are crafting a collaborative roadmap to really, do what is going to inflect the most in terms of staff productivity and lessen the burden that they're experiencing.
Yep, Sarah, I think that's exactly correct. Within that, as we look at identifying, where to partner, Sarah mentioned kind of our broad thesis. We'll say as long as a payer has a portal or an e-fax option that is, suitable for integration. And we work with most payer portal systems such as Evercore, Availability, and in specialties like diagnostic imaging, pain, et cetera. So I think in general, as Sarah mentioned, we work really closely in that space to identify, the work queue, the backlog, and then from an integration perspective, right, is there a portal or e-fax option?
All right, Bree. I think this next question is up your alley. Expanding patient access is a priority for us, but my team is short-staffed and struggling with reaching patients to close care gaps. What guidance would you give to us as we look into automation?
Yeah, this is a great question, Sarah, and I know one that a lot of organizations are focused on with a key interest in population health. When we think about this, there's a lot of systems out there that are, one, very manual for the staff, or two, are outreaching to the patient in an automated fashion, but then not completing the closing of that care gap by allowing the patient to schedule or report back that that gap has actually been closed elsewhere. And so, when we talk to teams, we really try to push them to, not just solve for one portion of this workflow. And, what that means is, are we looking at the patient's chart, identifying where those care gaps might be? Once we've identified them, are we outreaching to the patient in a way that that patient can say, yes, this gap actually is closed and it's complete, and we're able to bring that information back into the system? Or no, that's not complete, and we want to actually proceed and schedule. And then the last mile problem, right, is where after that moment, then the patient is actually able to schedule an appointment to close that care gap. And we see a lot of times, and we've heard stories of groups running campaigns to close care gaps, but then asking a patient to call in or potentially to present at a location, and that actually just causing downstream issues with the staff. So, when groups look at this, I think it's important to get the scheduling component correct so that patients can schedule, and also to have a solution where, you can triage patients to the right appointment. So you think of something like a diagnostic versus screening mammo. We want to make sure that we're sending patients to the screening mammo visit type and site for care. So all of those, we want to solve this problem holistically and then make sure we're actually pulling that information back into the system after sending the outreaches as well.
One more question. I'm just looking at time. I think we have time for maybe one or two more questions. So if folks want to put in one more. This question is very specific, but I'm excited because I think we've got a good answer to it. Our patients often have multiple appointments in a short time frame. How do you handle this with Notable?
Yeah, another good one, because this has been a personal point of frustration and one we've seen across the industry where, if you have maybe 3 sequential appointments coming up, you receive 3 separate texts for it or 3 separate check-in experiences. And in that case, it's, maybe frustrating for the patient because you're entering information in triplicate, or you're often getting spam text messages to the point where they maybe lose their effect. And so, one of the ways that we've solved for this is to pull all of those notifications together into one outreach, but then allow for confirm cancel of each individual appointment. And then again, loop that intake in for those shared components as well. So I think this is one we see a lot with specialty or subspecialty organizations, and know is a known pain point with a lot of the solutions out there. So we see really high rates of conversion, meaning patient interaction, as well as patient satisfaction with the experience when we're able to pull all those appointments together. Is there anything you'd add there, Sarah?
No, I think you covered it. All right, so I think this will be the last question. We are a small rural hospital. Do you only partner with larger organizations, or can you also support organizations on the smaller side? I can take that. I mean, one of the really fantastic things about Notable is that we are able to successfully partner with organizations of really all shapes and sizes, from large academic medical centers to smaller health systems that maybe have a couple of hospitals, to we have customers that are 49-bed hospitals that are the only hospitals within many miles. And I think for those smaller organizations, what's exciting is that we're able to bring cutting-edge technology that really has not yet been available to that part of the market. So, and at the same time, we really are pushing the edge in terms of innovation for larger health systems that frankly have been frustrated by the investments that they've made in the past, and the sort of piecemeal nature of them not really coming together to give that truly competitive, best-in-class patient experience that ultimately does, what the title of today's webinar alludes to, which is drive growth. So, really, really privileged to work with organizations of all shapes and sizes, and as Bree mentioned, on multiple EHRs. Bree, any parting thoughts from you?
Yeah, Sarah, thanks for asking. I love that you ended, or that it worked out to end on a question about, working across different types of organizations, because I think that's key as we're designing technology for patients and for health systems. Our patients all, don't look the same, right? Need a different outreach, and we spend a lot of time on that. But we take that same ethos to staff, providers, and to the organizations we work with as well. So I think that's a great ending note, and just gratitude for spending the afternoon with us.
Thanks, everyone. Hope you have a great day.